You are listening to the Journal of Rheumatology's Editor's Picks with Dr. Earl Silverman, Editor-in-Chief.
Hello again, this is Earl Silverman, Editor-in-Chief of the Journal of Rheumatology, wishing everyone a good 2025 and welcome you to the January 2025 edition of Editor's Picks. As this is a new year, I thought that we should try a new format for these podcasts. Rather than reviewing only the 5 articles I have highlighted on our website, I will briefly review all the articles in this month's edition of the Journal of Rheumatology. So this is really editor's summary of the January 2025 edition of the Journal of Rheumatology. This month, my interview is with Drs. Rashmi Dattal and Christina Chambers about their article titled Cardiovascular Events During Pregnancy, Implications for Adverse Pregnancy Outcomes in Individuals with Autoimmune Diseases.
I wonder if you could give us just a little background to the previous work that's been done in this area.
Absolutely. So there have been many studies that have looked at like cardiovascular events in patients with autoimmune rheumatic diseases. And we know that there is higher risk, but there's only been a handful of studies that have studied pregnant patients. And so we previously used the same California-based birth cohort that we used in this study to study the occurrence of acute cardiovascular events during pregnancy and postpartum in patients with rheumatic diseases compared to a reference group of pregnant women without rheumatic disease or without antiphospholipid syndrome. And so we did find that patients who have rheumatic diseases have higher risks of traditional cardiovascular risk factors and higher risks of acute cardiovascular events during pregnancy and postpartum by about 4.1-fold. This risk was higher in lupus 6-fold, especially in those with nephritis and APS, about 13 and 18 folds respectively compared to general population of pregnant women. Most of these cardiovascular events were venous thromboembolism, about half, and the other major ones were heart failure and dysrhythmias. And also from prior literature, we know that patients with rheumatic disease have higher risks of adverse pregnancy outcomes, such as preterm birth and small for gestational age infants. And while there have been studies in mostly in the general population pregnancies that suggest that having adverse pregnancy outcome puts the mother at higher risk for future cardiovascular diseases and events, but there really, we didn't find many studies that have examined the effect of cardiovascular events on adverse outcomes, particularly in rheumatic disease pregnancies, which actually have higher risks for both cardiovascular events and of adverse pregnancy outcomes.
I hope you enjoyed listening to part of my interview of our featured article titled Cardiovascular Events During Pregnancy, Implications for Adverse Pregnancy Outcomes in Individuals with Autoimmune and Rheumatic Diseases. I recommend that you read the full-length article and the accompanying editorial titled Cardiovascular Health and Adverse Pregnancy Outcomes in Autoimmune Rheumatic Diseases by Drs. Parimi and Ravindran, which are currently available on our website at www.jrheum.org. This month, there are 2 articles on axial spondyloarthritis. The first is by Roker and co-authors on behalf of the Canadian Rheumatology Association Spondylitis Research Consortium of Canada, and is titled Canadian Rheumatology Association Spondylitis Research Consortium of Canada, Living Treatment Recommendations for the Management of Axial Spondyloarthritis. In this article, the authors provide 56 recommendations for patients with active axial SPA, stable axial SPA, axial or stable axial SPA, for all comorbidities and for assessment, screening, and imaging. Recommendations are also made for the principles of management, disease monitoring, and ethical considerations in managing patients. As these are living guidelines, they will be updated in the journal on a regular basis. In an editorial broadening the landscape of treatment recommendations in the management of axial spondyloarthritis, Dr. Batista Milano from the School of Medicine, Universidad El Bogotá, Colombia, gives his perspective on the guidelines outlined above, as well as a role for living guidelines. The second article on axial spondyloarthritis is titled Improved Pain, Morning Stiffness, and Fatigue with Bimekizumab in Axial Spondyloarthritis. Results from the Phase 3 B-Mobile studies, and is by Navarro, Compan, and co-authors. The authors had previously published work that showed that in Phase 3 studies versus placebo, Bimekizumab had demonstrated sustained efficacy and was well tolerated in up to 52 weeks in this cohort. In the current study, the investigators found that Bimekizumab treated patient had more rapid improvements in levels of pain, fatigue, and morning stiffness as compared to placebo. This was true for both low spinal and peripheral pain. These improvements were maintained at week 52, demonstrating that Bimekizumab improved symptoms that were important to patients. Next, I report on 2 articles regarding psoriatic arthritis. It has been previously shown that cutaneous lesions in patients with psoriasis may do better in certain seasons, but the data on seasonal changes in psoriatic arthritis is only anecdotal. Joly, Chevier, and co-authors in a paper titled A Real-World Analysis of Weather Variation on Disease Activity in Patients-Related Outcomes in Psoriatic Arthritis investigate if there is a correlation between weather variation, disease activity, and patients-reported outcomes in 858 patients with psoriatic arthritis. Although they found a statistically significant difference in the CDI, SDAI between summer and winter months, these differences were not clinically significant. Similarly, they didn't find non-significant differences between weather measurements and pain and fatigue in both seasons. They concluded that though at a group level, there was a limited role for weather to be important in the variations of patient symptoms, at the individual level, it may be possible that patients with PSA may experience a more significant impact from weather-related factors. Previous studies have shown a wide variation in the estimated annual incidence of PSA, which has been reported to be as low as 0.06 per 100,000 person years at risk to a high of 41. Exrashu and co-authors studied this issue in Sweden in their paper titled Incidence of Clinically Diagnosed Psoriatic Arthritis in Sweden. They found that the estimated annual incidence was approximately 20 per 100,000 patient years at risk, and that it was higher in females than males, and in people aged 50 to 59 years. Interestingly, patients with greater than 12 years of education had a lower incidence of PSA than those with 10 to 12 years of education. They found that the overall incidence remains quite stable from 2006 to 2018, with no persistently increasing or decreasing time change against their observational period. 2 years after diagnosis, close to 3/4 of their patients had received a DMARD therapy of any type, while approximately 1/3 had been exposed to either a biologic DMARD or a targeted synthetic DMARD. Moving along to lupus, I want to tell you about a paper titled Incidence of Pneumocystic Jirovecii Pneumonia and Prophylaxis-Associated Adverse Events Among Patients with Systemic Lupus Erythematosus by Zhang and co-authors. This is a retrospective analysis of 6,017 patients from a SLE cohort from the Trinex database. They found there were 5 cases of PJP that were identified over 2,752 person years, of which one of the patients had received PJP prophylaxis. Majority of patients with SLE who developed PJP had structural lung disease. The authors suggested that the results of their study do not support the universal prescribing of PJP prophylaxis, but with patients with SLE without lung disease. We have 2 pediatric rheumatology articles this month. The first is regarding neonatal lupus erythematosus, which is a subject near and dear to me, and it is titled Genetics of Neonatal Lupus Erythematosus Risk and Specific Manifestations, and is by Mista and co-authors, of which I am one. The authors created an additive non-HLA and HLA polygenic risk scores using data from a large systemic lupus erythematosus genome-wide association studies. Outcome were any NLE manifestation, cardiac NLE, and cutaneous NLE. This study, which included 332 infants, 270 seropositive mothers, and 253 infant mother pairs, did not identify any significant associations between any infant maternal or maternal infant polygenic risk score and any NLE outcome. The HLA-wide analysis did not identify any NLE risk alleles. The next pediatric study is titled Epidemiological Characteristics of Patients with Juvenile Dermatomyositis in China, a multicenter study, and is by Liu and co-authors. The authors enrolled a total of 1,164 patients with JDM from 24 centers over a 5-year period. The ratio of boys to girls was 1 to 1.23, which differed from that found in cohorts from the US or the United Kingdom. Approximately half of the patients were aged between 6 to 12 years, and 20 patients had lung involvement. This is which is higher than previous studies. Interestingly, 2.2% had subcutaneous calcification at the time of presentation. The authors found that the mean expense for hospitalization was much lower in China than that described in studies from the USA, although the median time in hospital was significantly longer in China. We are looking forward to the long-term outcome of this large and unique cohort. It has previously been reported that the frequency of OA may be up to double in U.S. military veterans as compared to a U.S. population of non-veterans. This month's article on OA is by Lavin and co-authors, which is titled Osteoarthritis Across Joint Sites in the Million Veteran Program and Cohort, Insights from Electronic Health Records and Military Service History. The authors confirmed previous reports of sex and age-dependent differences in OA frequency and identified that OA was associated with a higher frequency of 16 of the Charleston comorbidities, as well as lower fitness levels. These associations were generally present at each joint. OA was most frequent at the knee joint, accounting for approximately 22.6%. Prior military engagement was significantly associated with the frequency of OA. Prior Army service was associated with a lower risk across all joint sites than veterans who are in other services. Our article on gout is titled Knowledge and Stated Adherence to the 2020 ACR Guideline for Gout Management, Results of a Survey of U.S. Rheumatologists, and is by Schlesinger and co-authors. 201 U.S. rheumatologists completed a 57-item questionnaire regarding adherence to the guidelines for the management of gout. The questions covered the use of urate-lowering therapy, including treatment goals, treatment regimens used, dosing and duration of the therapy, the use of prophylactic treatment regimens and duration of prophylactic treatment, management of flares, and looking at the conditional recommendations within the guidelines. Overall, there was good adherence to the guidelines with a overall stated adherence of 11.5 on a scale with a maximum of 15. Less experienced rheumatologists were more likely to state they were adherent to the guidelines than those with more experience, and those with a lower patient volume were more likely to state that they followed guidelines than those with a higher patient volume. Although overall, in the self-reported practice, U.S. rheumatologists tended to be adherent to the 2020 guidelines, there were still some issues regarding dosing. Both the guidelines and adherence to the individual guidelines are outlined in the paper. There is a accompanying editorial by Dr. Canna from the University of Michigan, Ann Arbor, USA, which is titled The Rheumatologist as the Agent of Change, Utility of Guidelines in the Management of Gout. She reviews why there are some discrepancies between the guideline and the use of urate-lowered medication, and in particular in therapies beyond the use of allopurinol. Sticking with crystal arthritis, it is the location of calcium crystals in calcium pyrophosphate crystal arthritis may be either intracellular or extracellular. In their article titled The Significance of Intracellular versus Extracellular Calcium Pyrophosphate Crystals in Diagnosing Calcium Pyrophosphate Crystal Arthritis, Harris and co-authors examined whether the site of deposition of the crystal was important for the presence of clinical arthritis in a cohort of 108 patients with intracellular crystals and 26 with extracellular crystals. They found that the presence of intracellular crystals was more strongly associated with episodes of acute or chronic CPP crystal arthritis, whereas the extracellular crystal location was less specific for the presence of arthritis. This month, the journal is pleased to present the proceedings of an international collaboration between Brazilian rheumatologists and dermatologists and the Group for Research and Assessment of Psoriasis and Psoriatic Arthritis, GRAPPA. The aim of this meeting was to promote medical knowledge, and particularly the optimal care and management of Brazilian patients with psoriatic disease. The title of proceeding is the first GRAPPA International Meeting in Psoriasis and Psoriatic Arthritis, Premier Encountre International de GRAPPA sobre Psoriasis et Arthritis Psoriatica. Please excuse my pronunciation. Article is by Goldenstein, Schonberg, and co-authors on behalf of all the participants in the meeting. The article describes 12 topics covered during the proceedings and emphasized the need for the multidisciplinary treatment of psoriatic disease. This month, we have 2 images in rheumatology. The first is titled Detection of Pancreatitis and Protein-Losing Gastroenteropathy Associated with Systemic Lupus Erythematosus by Protein Leakage Scintigraphy. This article describes a 19-year-old man who, at presentation of his SLE, had a low serum albumin despite normal renal function. The images show how protein leakage scintigraphy can be used to detect protein-losing enteropathy. The second image is titled Renal-Limited IgG4-Related Disease Presenting as Hypodense Lesion Found During Surveillance Imaging in a Patient with High-Grade Urothelial Cell Carcinoma. This image describes a 65-year-old man with a history of high-grade urothelial cell carcinoma, which was in remission. However, on a surveillance CT urogram, multiple renal lesions were noted. A biopsy of one of these lesions was negative for malignancy, but did demonstrate a lymphoplasmacytic infiltrate with numerous polytypic plasma cells, which stained positive for IgG4, which is characteristic of IgG4 disease. I want to thank you for listening to this podcast and encourage you to read all the articles in the January 2025 edition of the Journal of Rheumatology, either in the print edition or the online edition, which is available at www.jrheum.org. And please watch the complete interviews of the highlighted article and also past articles if you have missed them. They are available for viewing at our website and on our YouTube channel. If you have any comments or questions on these highlighted articles or any article in the January 2025 edition of Journal of Rheumatology, please send them to manuscripts@jrheum.com. And please join me next month when I will again summarize the articles from our February 2025 edition of the journal. Thank you for listening.